Hello there, nice to see you again. How are you feeling? Are you feeling any better with that abscess? A little bit? Alright. So today I'm going to be giving you a dental exam and draining that abscess, all being well. Yeah? I bet you're ready for that, aren't you? Okay. So how have you been on the antibiotics? I prescribed you metronidazole, didn't I? Were you okay on those? Good. They're probably one of the most effective for dental abscesses. Yeah, they can make you feel a little bit woozy, as long as you avoided alcohol. Yeah, they don't mix with alcohol. Okay. So I just need to get some gloves on. Okay. Squeaky gloves today. Have you walked here today? It's a nice day outside. I don't get to see much of it though, unfortunately. Okay. Let's just pop the cover over you. There we go. Perfect. Okay. So firstly, I'd just like to have a little feel around your jaw and the lymph nodes, if that's all right. Good, good. Okay. Just keep your head nice and still in that position. That's perfect. So just going down the neck there. Okay, just going to feel the lymph nodes there, the pre-auricular and the post-auricular ones, that's fine. And just under the submantle there, under the chin. Okay, lovely. And just want to check your temporomandibular joint, okay? So I'm just going to pop my fingers on the side of your jaw there, each side of your head. I just want you to open your mouth for me, okay? Wonderful. And close, and open, and close. Can you just move your jaw from side to side? Okay. I couldn't feel anything cracking or popping. You've not been experiencing anything like that, have you, when you're eating or opening your mouth? No? That's good, okay. Alright. So let's just take a little look at that abscess first of all. Just take them nice and wide. That's perfect, thank you. Okay. Alright. It does seem to have reduced, since last week. You were feeling pretty poorly then, weren't you? Yeah. Okay. Yeah. Alright. And while I'm there, I'll just check around your tongue and underneath the tongue, if that's okay. Right. Nice and wide, thank you. Okay. Just move your tongue to the roof of your mouth for me. Thank you. That's perfect. Okay, that's good. Alright. So I'm just going to have a little look around, okay? All round your teeth. Okey-dokey. Start with the upper left here, okay? So that's 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 14, 15, 16, and 17. Okay. Right. 26, 27, 28, 30, 31, 32. Okay. Right, just close your mouth for a second, I'll give you a rest. I'm just going to gently be checking around your gums now. Okay, I'll just be giving them a tiny little poke. Okay. Nice and wide for me, thank you. Your gum health is very, very good. It always is. If anything feels sore, just let me know. Just a little bit of scale there. Okay, lovely. Nice and wide for me, thank you. Just look on the inside. And wide again for me, thank you. Brilliant. Doing really well. Very little problems with your gums, that's really good. I wish all my patients were like this. Okay. Doing alright there. Nothing uncomfortable? Okay. You can just relax your mouth for a second. Okay. Nice and wide again for me, thank you. Alright. Yeah, that's perfect. Okay. There is just one little area of scale on this left side, but I'll be able to remove it with this, okay? You'll just feel me doing a little bit of picking, alright? Okay, nice and wide again, thank you. Alright, let's just... Is that okay? Good. Just one little bit here. Alright, okay. Just just have a little rinse for me. Okay. And just slip that into there. Perfect. Okay. Alright. So everything does look really healthy, but apart from the abscess, have you had anything of concern? No? Okay, that's fine. Yeah, you've only got one filling, haven't you? That's the one up here. Yeah. Yeah, that's fine. We did that last time for you, didn't we? Yeah. No problems there. That's good. Right then, just bear with me 2 secs while I just update that a second. Okay, so as far as the abscess goes, what I'll need to do is to administer a little bit of local anaesthetic. Now, unfortunately, because there's probably some infection still there, I can't guarantee that it's going to numb up 100%, okay? Where there's infection, it can be very hard to numb, but I'll do my very best. Alright, it shouldn't cause you many problems anyway. In actual fact, administering the anaesthetic just might puncture the abscess a little bit anyway, but we want to remove it properly. Alright? Are you comfortable with that? Okay, great. I'll just get it ready and I'll be back. Okay, so I'm just going to inject the area, alright? It may not numb up entirely, but we'll see what we can do. Fingers crossed. Open nice and wide. Just a sharp scratch at first. Okay. That's perfect, my lovely. Keep it like that. Alright. Sorry. Just popping little bits in there. Okay. Alright. Just leave that a second. You're one of the first patients to have my new tools used upon them. I quite like them, they're really comfortable. They're better than the other ones that I had. So I've just been using them today for the first time. So let's just have a little peep in there. Okay, just a little look. I'm just going to check it. I'm just going to touch with this and you can tell me if you can feel anything. Okay, my lovely, thank you. You felt a little bit there? There? No? Just there. Okay. Let me just give you a little bit more then. Not a problem. I hope it does entirely numb up, but I said there's no guarantees with there being infection. It can make it a little bit difficult. I'm going to keep you on the antibiotics for a little while longer anyway, just to make sure. Okay. Okay. Hope nice and wide again. Thanks very much. Just going to have a little look at the check. Okay, could you feel that? Could you feel that? Good, good. I think that's going to be numb enough. For sure. Okay, so when it comes to the abscess, I'm going to be just using a blade and I will just quickly make a very, very tiny incision, okay, and drain that away with a little pressure. Alright? Okay, so are you ready? Okay, just relax, okay, relax, nice and wide. That's wonderful. Okay, just going to make tiny, tiny incisions. Well done, well done. Okay, little bit of suction here as I just press on the area, okay? Is that hurting at all? No? Okay, I'm just you'll feel the pressure but hopefully no pain. Okay, just gently pressing on there to express the contents. It's not a huge abscess, but they're very, very sore. Yeah, they are. There we go. Okay, perfect. Right, we'll put that on the area. Just hold it in place with your cheek for me. That's perfect, thank you. I'll get reception to give you the prescription. They'll print that off, okay, for the rest of the antibiotics. Just for another 5 days, just to make sure. Okay, right, let's take a look at this then. Okay, lovely. That's looking good. Okay, let's pop that back in there and just hold it on the side of your face. Thank you. Just give it a moment. Does that feel all right? Good, you've done really, really well. Okay. Let's have a little look now. Alright, that's really good. Yeah, the swelling's gone down a lot there now. It's not even bleeding anymore. That's good. That's really good. Okay. Just going to give you a little bit more suction. Alright, okay. That's wonderful. Let's check again. Check around the area. Okay. I'm really happy with that. Right, you just have a little rinse. Okay. And pop it in there. Thank you. Yeah, you'll find that will soon heal up now. Once those antibiotics finish the last of it off, and now it's all gone. Okay, we'll keep an eye on that tooth. When the infection's gone, we will have another good look round that tooth. Yeah, for sure. Okay, so let's just have one last little look around there. That's wonderful, nice and wide for me. Thank you, lovely. Okay. Alright. Yeah, I'm really happy with that. Definitely. That's definitely empty. Looks so much better already. So the big swollen area has really subsided now. Yeah. Okay, just relax your face for a little while. You've held it open for quite a while for me today, haven't you? Yeah. Okay. Right. I'll get you back in a week's time. Yeah? Alright. I'll pop that on for reception, so when they give you the prescription, they'll give you your appointment as well. okay, for a week. They'll sort that with you on your way out when you pay. Yeah. Okay. All right. So let's get rid of your paper. Got to keep you nice and tidy, haven't we? So, yeah, make your way to reception and I'll sort you out with an appointment and your prescription, and I'll see you back here next week. In the meantime, if you do have any problems, please give us a call, yeah, and we'll get you down to check it all out. Okay, yeah, it was only a tiny incision, so there shouldn't be any major problems with that. Yeah, we'll just do a little salt rinse. That can help with any irritation once the anaesthesia wears off, and just take some paracetamol as well. It just might throb a little bit as the anaesthesia wears off. And I say the antibiotics are already in your system working well. We'll just continue it for those extra 5 days just to make sure. Okay? Alright, so enjoy the rest of your day, and I'll see you in 7 days, and hopefully not before. Alright, take care now. Bye bye. Oh, hello there. Please take a seat, get yourself comfortable. Be with you in a second. Alright. Okay. So just confirm your name for me, please. Okay. Date of birth. Okay. And could you just confirm your address and telephone number, please, just to make sure everything's up to date? Sure, you can give me that extra number, yeah? Okay, yeah. Yeah. Okay, perfect, thank you. It's always good to have more numbers. Okay. So what can I do for you today? Okay, so you've got some mouth ulcers and your gums feel sore? Okay. Any pain in your teeth at all? Okay. You're all up to date with your dental checks, aren't you? Yeah. Okay, so how long have you been experiencing this pain and soreness? Okay, a couple of weeks, alright. Do you have any other symptoms at all? Okay, you've been feeling a bit tired, run down, okay. Is there anything that you think may have caused that feeling? No, okay. Alright. You've not had any infections recently, anything like that? Alright. Okay, not been eating a lot of acidic foods? Okay. Any medications, new changes to others? Okay, no. Alright. That's perfect. Okay then, so let me get some gloves on and I'll start to take a little look around your mouth if that's alright. Okay. Just get an apron on. Around you. There we go. Perfect. That's good. Nicely covered up. Okay then. So, firstly, I'd just like to take a little feel around your lymph nodes, okay? Alright, just keep your head nice and still for me, my lovely, thank you. Not noticed any pain or unusual swelling around the area? Okay. Alright. And I'm going to place my fingers on the side of your head. Okay, I'd like you to open and close your jaw when I tell you to. Alright? Okay, there we go. Open and close. Okay, and again for me. Open and close. And could you wiggle your jaw from side to side for me, please? Okay. So there doesn't seem to be any problems with the temporomandibular joint there. I couldn't feel any clicks or pops. And there's no visible or palpable swellings of lymph nodes. So that's good. Okay. Right. So what I'm going to do is just grab a hold of your tongue and just move it from side to side and have a little look around at first, okay, before I start with the tools in your mouth. All right, my lovely. Okay, so open nice and wide for me. Thank you. Okay. Right, I've got your tongue there. It might feel a little bit weird because obviously the gauze is quite dry. Okay, I'm just going to move the tongue around, just going to your right. Okay, left. It down a little. Okay. Alright. Just take a swallow for me. Okay. Right, so I'm just going to pop my finger into the cheek area and move it around a little. Okay. Okay. I'm just going to have a little feel around. Is that okay for you? Right. Okay. Just relax your jaw there for me. Okay. So, just want to take a little close look and use this light here. This will be the better one. Just inside, okay. Just open nice and wide for me again. Okay. Can you just pop your tongue out and just say ah for me? I'll just check the throat area. Okay. Alright, I'm just going to have a look around, just move your cheek away a little bit again. Close look around. Oh yeah, I can see that you do have a number of quite new mouth ulcers there. They do look sore and irritated. Let me just look below that. Okay. Alright, yeah, I can see those. Okay, just relax for me, my lovely. Have you been putting anything on the ulcers? You put a little bit of Bonjela on, okay. Has it helped? But you've still got new ones for me. Yeah, you can tell that these look quite new and fresh. There are some that look like they're healing, but you obviously are producing new ones, okay. Now we know you've got no dentures or anything like that, which could be causing the problem, so we need to have a little closer look around. Okay. So I'm just going to gently start looking around your teeth, alright? I'm going to use this tool with my mirror. I just need you to open your mouth nice and wide for me, and I'll have a very gentle look around, okay? If anything's uncomfortable, pop up your hand, alright? Okay, so nice and wide for me. Thank you. Okay. Just starting to have a nice little look around. Okay. Just going to just gently touch your gums, okay, very, very gently as I go along, okay. tell me if anything hurts. Your gums do look a little bit sore. You're doing all right there. Good. Just have a look down at the bottom. Tapping your teeth a little bit as well as I go along. Okay. Just relax your jaw a second. There we go. Yeah, you've got about, I can see about 8 ulcers at the moment, so they must be extremely painful for eating, drinking. They're so sore, aren't they? While you've got these, do be careful what you do eat and drink. Nothing spicy or acidic, as you may have already found out, because it will make the pain worse. Okay. Okay. Nice and wide again for me. Thank you. Just going to have a look up here now. So, from what I'm seeing so far, your teeth look okay, but there is definitely some gum inflammation, but I'm not sure what's causing that because you don't have any plaque build-up. Okay. Your teeth look really clean. Do you clean them twice a day? Okay. Okay. You're just having a little feel around just below. Just behind that bottom lip. Is that okay? Nice and wide again, thank you. Yeah, teeth look fine. Honestly, they really do. I just need to take a closer look at these. Okay. What I'm going to do, okay, is just get a little bit of a solution and just pop it on to these ulcers so I can just have a little closer look without them causing you any discomfort. Is that okay? Alright, just bear with me a second. Okay. Got a little solution here. So numb these little ulcers up just while I check at them closely. Okay. So, just open nice and wide for me. Okay. There we go. It's going to drop a little bit in. Okay. And there. to give it a little rub around with the paws. Okay. Gentle rub around there. Okay. They'll numb up very quickly. I just wanted to have a closer look around without causing you so much discomfort. Okay. Alright. Open nice and wide again. Is it numb now? Okay. They're not bleeding, and the gums aren't bleeding. They just look a bit angry. But I know they're very sore, very, very sore. Just going to shine my light in there a second. Just going to go to the back of this side where there's one, the back right at the top. So, sorry if that's a bit uncomfortable on your cheek there. I just want to have a good look. Okay. Right. A little look round, just at your teeth. Just at those back teeth again. Okay. Lovely. Well done. Is that okay for you? Good. Right, just having a little tap around now, okay. Alright. Yeah, just relax your jaw, okay, for a second. I just want to put some information in there. Okay. Okay, nice and wide again. Thank you. Yeah, there's very little in the way of scale in here, so you know it's not like there's gum disease through poor hygiene. Right. Okay. Let's just give you a little rinse out there, okay? There we go. In there. Perfect. Okay. Right. Because I can't see any real problems with your teeth or real signs of gum disease there, I think what I'd like to do is get you referred to your GP. Okay, I'd like them to check your vitamin B12 levels. Okay, and do a general blood count as well, because sometimes when people get low vitamin B12, it can cause them to get very sore mouths and mouth ulcers. I do notice you've got a little crack on the edge of your mouth as well, which can be indicative of some deficiencies. Okay. And you said you've been feeling tired as well. Yeah. So, who's your GP? Have you got that detail on here? Right, yeah, I've got that on here. Okay. Is there any particular doctor? Yeah, that's the one I've got down. Okay, that's fine. I will call them as well and get them to get this arranged for you. And they'll probably call you and ask you in, okay, to get the blood test done. Okay, they're only in the clinic down the road, aren't they? So we all know each other very well. But I would rather get that checked out because, say, you don't really have problems with those teeth or gums that I can see. That's really of dental of origin. Okay, I think there may be something else there. All right. Okie dokie. Right. So I've done that. I'll get you free of your apron. All good there. Okay. Get those blood tests done, then give me a call. Alright, let me know what the blood tests say. I should get a report from the doctors. Alright, but if I don't, I'd love to hear from you. Hopefully they can get you in soon. Okay, and then the doctor can treat that for you from their end. Alright, but I'll see you back here again if you have any more problems or for your next routine appointment. Yeah? Okay, well I hope you feel better soon, and fingers crossed I'll get those blood tests done very quickly for you. Okay then, my lovely. Take care. Bye-bye.